Hi, I'm Megan Kingsley Gale with the Hospital Practice Handbook Project, and tonight we have a wisdom share session with Sondra Abanto, who has her master's in business, her MBA. And tonight we are talking about mentorship and career path mapping. So, Sondra, welcome.
Thank
you for
you.
coming tonight to talk
My
with us.
pleasure.
So we're going to talk about informal and formal mentoring.
Yes.
So, where would you like to start?
I guess we can probably go by our outline. And I think,
Sure.
So talking about mentorship, I think one of the first things was how can a mentor help you in terms of career path mapping?
Yeah. So I know, so in traditional Chinese medicine, traditional Asian medicine, as acupuncturists, that's what we're trained in. Mentorship is a big part of just what our field is, what our clinical practice is. We're always encouraged to have at least one clinical mentor or career mentor. And but mentorship, when you're in a hospital practice setting or a mid to large organization. So this whole series is about the basics of being an employee in a mid to large organization with focus on performance management, because Sondra is a performance management expert, that there's actually more resources available to you as an employee. So what as a hospital practice employee, I'm a clinician. What would make me a good mentor candidate, or if I'm a mentee and I'm looking for a mentor, what are some things would I look for in someone who would be a good mentor in my hospital practice setting?
That's a great question. And I think part of it is what you want to get out of the mentoring relationship.
Okay.
So for example, if your goal is to advance your career, especially within that mid to large size organization, you probably want to have a mentor that's a veteran of that organization and has some miles under their belt and can give you that insight into the culture of that organization, some of the pitfalls you would want to avoid, and then how you can advance your career. One of the things I think that makes mentoring so interesting is that you don't necessarily have to define mentoring one way. It's very diverse. And so you may want to have a mentor that is completely out of your area of expertise, especially if you've just been in a clinical setting as a student or as a resident, and you've had that one-on-one mentoring, or you've had that small group mentoring as you're going through the clinical practice. Going to a new organization, you may want to pick somebody that's a mentor that knows the organization but gives you a totally different perspective. So it could be a physician, it could be a physical therapist, it could be an admin professional, someone that's really going to help and guide you. And leadership really doesn't have a career confine. And so you'd be amazed to learn from people that are completely out of your area of expertise and what they can bring to you, and then also how you can influence them to make decisions. And something that's fantastic is if you introduce them to complementary medicine, or you introduce them to the art and science of acupuncture, you have no idea how they can impact the organization and make it more welcoming. So I think the first question is, do you want to have a mentor that's in your career track? And that's great. There's nothing wrong with that. And I think it's a great choice, especially if you're not sure. But depending on what your goals are, you may want to look outside of your area of expertise and find someone that's in a different career path that can give you some insight as well, kind of in a contrarian viewpoint.
Okay. Well, I think for me, for a lot, so it would be great if like my supervisor happened to also be an acupuncturist, or there was multiple acupuncturists who'd been there for 10, 20 years in the hospital setting. But for most of us, that's not the case. A lot of times we're the first one, or we're one of just a handful who's been there less than 5 years. So there's a lot that most of us don't understand about what's going on in that hospital setting, that someone who's been a nurse there for 10, 20 years would really know how the system works. Like, who do you report to? What happens when this happens? And so I think for those of us who are in that situation where other people who are in my field of acupuncture or integrative health might not have been there much longer than me. So they'd be great people to have peers for, but for clinical practice, I might be going outside of hospital-based practice. But what I might be looking for is someone in a different field who has like 10, 20 years of experience. So when I'm looking for someone who's 10, 20 years of experience, as a mentor, what are some things, I guess I kind of talked a little bit
Right.
about that, but what are some things that they can bring to me that are not, that someone, because they're not in my clinical
Right.
field, but they're with the organization,
Mhm.
what kind of wisdom would I be looking for, and what things that I just don't even know to ask?
Right.
Okay.
I think there are several things that a good mentor with a lot of experience can bring to the table. And so when you're searching, number one is, do they really know that organization? Have they been there for a long time? Do they know the people that make decisions?
Okay.
I always try to take, for me personally, and this is, not to say anybody else has to do this, but I love getting somebody that is almost uncomfortable with what I'm doing or kind of angry at the department I work in.
Okay.
Because there are barriers that I don't see that they see and they have to deal with. And so it's nice to work with somebody that maybe is not into complementary medicine and they have very strong feelings about it, whether they're justified or not, because, maybe they had a bad experience or maybe they had for whatever reason. And so if you go and talk with someone that's a nurse,
mm-hmm.
and really get that hardcore clinical 20 years of experience, they can come to you and say, this is my perception of what acupuncture is or herbal therapy, or this is where I've seen that I didn't agree with it. And then you can be a mentor to them as well. And as you're having that relationship and that contrarian viewpoint, it helps you progress your field forward. So I love to find people that have a complete opposite skill set than myself and find out what scares them and what really excites them about what I'm doing.
So for you, you're confident in what you're doing to the point where you feel like, hey, I can reach out and look for someone who has a contrarian viewpoint.
Yes.
That a little bit of conflict, it doesn't scare me. I'm actually going to learn a lot from that.
Absolutely. And I, given my personality, I like someone that challenges me, but I also want somebody that says, hey, I know this is tough. I know this is hard, and we're going to do this together. Or we're going to figure out a way. And also someone who is already plugged into the network. And so if you have a great idea about how you can improve the clinic or how you can improve the dialogue between doctors and nurses and acupuncturists, then they may be the person that can introduce that topic, or they can put you in touch with the people that are decision makers, either formally or informally, and it may be even something where during the course of your relationship, the mentor's like, wow, that's a fantastic idea. And they can actually take action on that. So there's something to be said for having someone that's completely opposite of you. At the same time, depending on your personality, you may be, especially I know when I was early in my career, I was very unsure. Mm-hmm. I would project confidence, but I would have inner turmoil. And so I had the privilege of having some great role models in terms of my mentors who were, you got this, you can do this. I'm on the same track. I was where you were 20 years ago, and I don't want you to make those same mistakes that I made. And so there's also a time when having someone that's a cheerleader and supportive and challenging is also better than having that kind of aggressive in your face, like, hey, let's talk about this, let's box it out, all for progress. But, it's fantastic to also have a cheerleader and someone, frankly, who believes that you're capable of more than you even believe that you're capable of, I think is a great skill to have in a mentor.
So it sounds like ideally you have more than one kind of mentor.
Yes.
To grow as a professional.
I think as you go throughout your career, I think there's going to be mentors that come and go, and they serve a specific purpose depending where you are in your professional life. And then I think there are people that you're just going to hit it off with, and they'll be a guide and a resource for the rest of your life, the rest of your professional life as well.
I know in my personal experience with mentors who are vastly more experienced than me, and even just peer mentors, of all those different relationships, the ones that I learn the most from, when I have a conversation with them, I have to sit down. I go after the conversation, I sit down and I'm like, what was that? And so I sit down and I write notes. And I'm like, wow, like these are things that I never would have thought of. Like almost like the really great ones, and the really great conversations is like almost like touching fire. Like, oh my gosh, I don't know if I can do this, but they think I can do this. And so I write it down and make a plan. And sometimes the brain is just not ready to incorporate all the information right now. But I find that I go back to those notes and go back to those people and be like, okay, this is where I'm at right now. And I just really grow versus someone who's just like, oh yeah, Megan, you're doing great. Like, I totally need those cheerleaders.
Right.
Because sometimes it's just hard to move forward on those hard days. But I think the people who challenge me and bring up amazing ideas and potential, and that I'm just like, I just thought that was an impossibility. I don't really think I can do that at all. I just grow so much more from that.
I absolutely agree. And it's funny, I was watching the movie Bull Durham last night, the baseball movie with Kevin Costner and Tim Robbins, and he's a mentor. And I thought this is so timely, because here is this experience kind of on his way out of baseball as a career person, and they bring him in to teach this young hotshot pitcher how to make it to the big leagues and succeed, not just make it, but then actually succeed. And it was just really interesting, because they had that, even though they were in the same line of work, they had a very different personality.
Okay.
And so, it just kind of cracked me up. I'm like, how perfect is that? He pushed that guy to be better.
And what's the name of the movie?
Bull Durham.
Bull Durham. Okay. All right. You guys go look that
Old
up.
School movie. Yes.
Okay. Okay. So we talked about what is a good mentor candidate.
Yes.
And
something I almost completely forgot, which I think is the number one, is trust.
Oh.
And just, you want to have the ability to sit down with that person and tell them a lot of things that are scary and sensitive and make you vulnerable, and feel like that's going to stay there unless you give them permission to do something or say something, etc. And that's probably the number one.
That's if when you're new to a system, that's really hard to find someone to trust, and it's usually not your supervisor.
Correct.
Because they can't keep things in confidence, because it's all not in the same way, because they're your supervisor.
Right.
So it sounds like mentors who are your supervisors are not ideal mentors. Like, you can learn a lot from your supervisor, but that's not who you want to have a mentor relationship for the trust aspect.
Correct. You want to find someone, and you're going to ease into it, just like any friendship, just like any relationship. You're going to ease into it, and as you see that they are trustworthy, you're going to be able to divulge a little more information. Not to say that your boss couldn't be your mentor, and they may be in the future after you've left their area of responsibility, that relationship. But I think that there are things that you want to bring to the table that, you're right, are not things that a supervisor is going to have the ability to refrain from commenting on or taking action on.
Okay. All right. And then I think the next question was, how does that mentor provide assistance? We talked a little bit about that.
Right. And it depends on organizations. So, for example, I looked at some of the mentoring programs that they had at Johns Hopkins, and then from when I worked at NIH, they have a whole.
So far we've been talking generally about mentorship and informal mentorship.
Right.
And so now we're kind of getting into something that is actually a new concept to a lot of us. Is there actually is organization-sanctioned mentorship programs, like official programs that your organization actually sets up and sets aside time for you for. Because we talked about performance plans last time.
Yes.
That you should be allowed time for things that you're doing for the organization, and have that in your employee record when you're getting evaluated. Like, hey, I spend 25% of my time doing research.
Right.
I'm 75% clinical, or, maybe I do 10% of my time in outreach, but having percent time in a month for your mentoring program when it's officially sanctioned versus informal.
Yes.
So you talked about Johns Hopkins and NIH. Okay.
Yeah. So for example, they have very formal programs, and depending on what area you're employed in, it's going to look a little bit different. So they may have programs where, if you're a researcher, and I don't know the name of the institute over at NIH anymore, for National Complementary and Alternative Medicine. I know they changed their name.
NCCIH.
Yes. So they used to be NICAM, but so they've changed their name. But for example, if you're doing research there, you have the opportunity to participate in an NIH-wide mentorship program.
Okay, not just in integrative health. Like, I could work with a pathologist.
Absolutely.
Who is all about environmental, like the flu or an epidemic or,
Yes.
public health. Okay. Anyhow.
Yes. So you would have anybody in those 28 different institutes at your disposal if they're part of that mentorship program and they've signed up as a mentor. And so you also want to incorporate that into your performance plan and your individual development plan, where you set aside a certain number of hours for meeting with your mentor. There's an expectation. And if you're in a fellowship, oftentimes with organizations, they'll have a fellowship program, and that may be a mandatory part of their fellowship program, is that you must have a mentor and you must meet with them on a certain basis. And you can interview mentors and see if you're a good fit, because sometimes you don't click. And,
sure.
And so you may have to seek another mentor.
Okay. But it's a organization sanctioned program. And so how would I find out about that? Sometimes as a federal employee, like I've been a federal employee, sometimes you have, or an employee of any organization, you have so much on your plate.
Right.
Especially if you're in a new program or new to system, you're doing so much, like knowing that there is a possibility that, hey, mentorship, official or unofficial, is available to you. Who would I talk to who would know more about it so I could sign up? Because sometimes those are like you sign up and then 6 months later you hear about it.
Right.
Okay.
So depending on the organization and depending on the formality of the program, your first stop might be to human resources or your training organization, or your professional development organization. It's some flavor of training or HR.
Okay.
And they'll be responsible for administrating the mentorship program. Normally there's a site where you can go in and you can enroll, and you may have to provide certain information about where you work, what you do, how long you've been there, what you're looking for in a mentor. It can be a million different varieties the way that they administer the programs. But what they have in common is, for those programs that are mandatory, it's typically through a professional development organization or their training or their HR.
Okay.
And then you'll hook up with your mentor, typically electronically. If you're in a fellowship program or you're a new hire, then it may be part of your onboarding process too, is that they give you information about the mentorship program. Worst case scenario, just go to the internet and look and do a search, or go to Google and do a search. And oftentimes that's the way to find those hidden gems.
And they're usually called mentorship.
Yes.
Or is there any other term that gets used for that kind of program? Sometimes
they're called sponsors. Sometimes they're called coaches, career coaches. So it may be under mentorship, career coaches. I'm trying to think. Another place to go to is like your employee assistance program. If your organization has it, yes. And typically those are the people that they'll offer the behavioral counseling. They'll offer career assessments. It's almost kind of this really cool shop of wonders that are hidden gems within the organization. So they oftentimes can recommend a mentorship program as well.
Okay. But just going to the union, it may not happen.
No. So I would say, if there's not anything given to you when you're onboarding, or you don't hear it from your sponsor that's helping you get acclimated, then Google, and then look for it. But for example, NIH, it's through their training department, and we had posted some links about that.
Yeah, and I will post the links related to this video again for so we had NIH and
Kaiser Permanente.
Yeah, which actually has hired a lot of acupuncturists into their programs. So Kaiser Permanente has one, NIH, Health and Human Services, and the Department of Defense. And I'm guessing the VA probably does as well.
I don't remember. And I worked at the VA. But I'm sure all the VA people are probably yelling at me going, of course we do.
So if you guys have a mentor program at your healthcare organization, please post in the comments once we post this video, and we can kind of have all those resources together, because the Hospital Handbook Project is about wisdom sharing and helping each other find resources when we're able to share that kind of information. So great. So we talked a little bit about is it better to have an internal mentor or external mentor? Right. I mean, I talked about it with immediate supervisor and the trust thing.
Right.
But so internal versus external mentor, do you mean within the clinic or?
Yes, within the clinic. So if you have the luxury of being in a large organization where you may have multiple clinics, and lo and behold, there's an acupuncturist that's been there even 2 or 3 years longer than you, reach out, see if that person can be your mentor, because there's specific questions that you'll be able to ask them without the fear of that getting back to your organization. And we talked about chain of command, the reporting structure that's in place. And so it gives you the ability to have confidentiality, and you can talk to your mentor that's outside and really doesn't have they don't have what do they say, a dog in the fight, because they're not vested in your clinic.
Say I'm in the pain management clinic,
right?
And which is a completely separate structure than say, I'm trying to think of like OBGYN. And the other acupuncturists in my facility is at OBGYN.
Right.
And so her chain of command, the only similarity is like the person who's in charge of the hospital. But we have different department heads and
different departments and so type of thing.
And we can, just like physicians, like another person who's a physician, we can talk to each other as peers. And in fact, we might actually be required, if we're the only two acupuncturists in the facility, we might be required to do peer record review of each other's records and have to talk anyway that way.
Right.
But just reaching out and having a relationship with them, even on a basic level. But if they've been there a few more years than me, they might actually, if they're up for it, I would love to, reach out to them and learn more about, they might have already finished a lot of policies and procedures and standard operating procedures, SOPs, that like from clean needle technique to biohazard disposal, that like, hey, they might just be like, hey, I already finished it. Why don't you, it's already been adapted for our clinic. Why don't you just take a copy of it and then, put your clinic's name on it. We're part of the same healthcare organization.
Right.
Just, help each other out.
Yeah, I definitely think if you're in an environment that's a little bit difficult, if you're the only acupuncturist there, I strongly encourage you to find somebody with connections that are not in your swim lane, and just have somebody completely independent and outside, still your organization, but kind of outside. Or you may want to go completely out of your organization. The nice thing about the National Institutes of Health is they're part of the Health and Human Services umbrella. So you could have an NIH specific mentor.
For those of you who don't know, the department, so we're talking about, this is all US, United States of America stuff. So for those of you who are outside of the US, I don't know how much this will apply. You have to kind of take it with a grain of salt or a few pickles. I don't know. But so the NIH is the National Institute of Health. It's under the umbrella of the Department of Health and Human Services.
Right.
Department of Health and Human Services does a ton of things, including, I think they run Medicare and Medicaid as well, right?
They do, and they also have the FDA as part of Health and Human Services.
Okay. So the Health and Human Services has really gigantic organizations under its umbrella. So it's not terribly, person in charge of Health and Human Services is not going to be in charge of you. There's way too many layers.
Right.
Okay.
Exactly. So
even within NIH,
you can have a lot of separation. And then if you still don't feel comfortable, if you want to go completely out of NIH, then you can go to Health and Human Services. I'd imagine Kaiser is similar because they have so many locations and so many clinics. I know they have a nurse mentorship program. I didn't get a chance to see because I obviously don't have their intranet access since I'm not a Kaiser employee. But they probably are so large as well that you could have an external mentor that's not in your specific organization.
Okay. Yeah. So like say if I was at NIH and I'm in the NCCIH, I could be looking for a mentor that's still within NIH and understands what NIH does, but they're not part of NCCIH. Okay.
And they could work for the National Cancer Institute. They could work for National Heart, Lung, and Blood Institute. So there's
and those are all institutes that have been around a lot longer than NCCIH, and they might have more experience with funding and the ups and downs of funding and many other different things. So and then to relate back to clinical practice, like so if you're in like the integrative health clinic, that might be likely a brand new concept versus being in the oncology unit.
Right.
It's relatively new in the grand scheme of things, but still been around longer than integrative health clinic. And then even before that, there might have been physical therapy and psychology. And often I find in behavioral health, which psychology is a part of, that psychologists often have more in common with integrative health professionals, but they've been there for 30 years plus, and they've been navigating all these issues of being a non-physician in the culture. So, okay.
Yeah.
So cool. Does your mentor need to sign an agreement regarding your professional mentor relationship?
This is another, it depends. So if there's a formal mentorship program, they may have a statement of understanding that both the mentor and the mentee have to sign. Depending on how formal their program is, you may have to meet on a certain frequency or have a certain, military terms, battle rhythm.
A certain battle rhythm.
Yeah, a certain battle rhythm or a certain frequency.
Bring that into your civilian hospital.
You
need a battle rhythm with your mentor.
I try so hard to get the army out of me, but so there should be a frequency if it's really, really formal, or you may be able to state this is how often we're going to meet.
And meeting can be by an email check-in or in person.
Email, it could be over a cup of coffee, just away from the work site. It could be virtual. When I was in Germany, my mentor for the Army was actually in Fort Leavenworth. And so he and I would have
which is that's not in Germany.
Yeah.
Fort Leavenworth
is not in Germany, stateside, and there's a significant time difference. So we would find a time that was convenient. We'd schedule everything up front, pass documents back and forth. So for example, he would say, hey, let me take a look at your resume and let me give you some feedback on your resume. And if you're trying to do this career path, I'm going to look at your resume and say, let's tweak this so you're more competitive in this particular area.
Okay, so my mentor can actually help me map out my career.
Absolutely.
Not just like be a shoulder to cry on or help me navigate how to just be in that organization, but they can like, hey, this is, you should probably set up your retirement fund kind of thing. Your mentor can be like,
they can give you so much information. It doesn't have to be just about your core duties as an acupuncturist. Sometimes, I know it's hard to believe, depending on what job you have, you may be so concerned about healing patients that you don't think about planning for the future.
Yeah.
And when you want to get out of corporate America and you want to open your own business, and you may not have that skill set. So how fantastic would it be to get a mentor that, I don't know, has an MBA, might know about TSP plans and pension plans and all that good thing. Not to say there aren't acupuncturists, send me your email, that, aren't fantastic with the market and pensions and retirement. But that's another opportunity where I said, if there's something that you struggle with, find your mentor and say, look, I really need help with this. And they may come back to you and go, oh my gosh, and I've actually had those where you go, you know about acupuncture. My grandson or my nephew or my niece has this issue. What do you recommend? And I would say, go to an acupuncturist. That's what I recommend. So there's that interchange of things where you can become the mentor for them for different things. So it is a two-way relationship. I was laughing when you said you cry on their shoulder. You shouldn't just be crying on your mentor's shoulder. They should be helping you say, okay, now we're going to pick ourselves up with our bootstraps and we're going to move forward. Like, yes, let's cry, but then how are we going to move past this so it doesn't happen again?
Awesome. And then the last question was, does the organization offer formal mentorship programs? So we kind of talked about
We covered that. Yeah, absolutely.
So, we've been talking about like how to find a mentor, but I've got a couple of questions from people who are like, well, how can I, I want to mentor other people.
Yes.
So what are some things if you are like, hey, I am at a place where I've received mentoring for a while. I'm going to continue receiving mentoring, but I've been practicing 10 years or so, and I've got students who would like to learn. I like to pass on what I've learned to others. Yes. What are some good ways for someone who wants to be a mentor to kind of get started on that path?
So you can go the formal route of signing up to be a mentor with the National Institutes of Health, with the Department of Events. They actually have a website where you can go in and volunteer your services to be a mentor in that formal way. I've actually been an informal and a formal mentor, which I know I'm so young, but there's people younger than me. I'm not young at all, but
no, she is. You are.
So, for example, when I worked for Health and Human Services, I had a person that was a student employee. And so she wanted to get a full permanent job in the government. And so a lot of our conversations were informal at first. And it was about, hey, I really like working for the government. How can I make this last beyond when I'm getting my undergraduate degree? Because this is something I would like to do after I graduate. And then I also was a mentor in the Army, a formal mentor in a formal program. And it was basically, we worked together, but she requested I be her mentor. Okay. And so I said, oh yeah, sure, absolutely. We had different functions within the same organization. And so we both signed up and we would meet and talk. Sometimes it was via Facebook, sometimes face-to-face, sometimes over the phone. Okay. But basically, you know, just trying to meet and give feedback on, okay, what is it you're doing now? Where do you want to go? Where do you see yourself? And then helping that person find a way to do that. And so there's ways where it spontaneously happens because you have a working relationship. Somebody may recommend you as a mentor, or you can volunteer yourself. Like if you see someone that it really shows potential, or maybe somebody that's struggling, then, you know, start out formally and say, hey, you know, can I help you out with that? Do you have questions? How can I help you? Because I've been in your shoes. If their experience and what they're going through resonates with you, whether it's good or bad, then you can help guide them informally, and then it can evolve into something formal.
Okay, cool. And when you have these organization sanctioned programs, do they kind of provide you with, if you're new to being a mentor, like you have plenty of stuff to share, but is there like do they provide kind of a structure so that if you're like, oh, I'm not really sure what to talk about this week, but we have this time set aside, do they have is it common for them to have like a mentor manual to be like, hey, you know, these are some guidelines for how to start conversations, or even some training about like how do you mentor people, and what are some healthy questions to ask, and what are some things you really should not go into?
Part of that is your statement of understanding, or your mentor agreement, and it will give you parameters, and it may give you some guidelines about what's appropriate, what's not appropriate. The mentor that I had from the Army actually had his own mentor-mentee agreement that he composed, because he felt like it was really important to lay out what he thought he could be an assistance with, and what he thought was, well, maybe that's beyond my scope. And so it would say things like, in the course of us talking, we may cover things that have to do with human resources or career advancements, but you want to seek the professionals in that area, because what I say now may change or may not be completely accurate, because I'm going off of something that I read 2 years ago. So, you know, kind of check with your official person. So a lot of caveats in there.
So in an ideal mentor relationship that is scheduled regularly, about how many hours a month do you feel like is common or normal for?
I would say, you know, probably meet 1 to 2 times a month. And depending on what the topic is, I would say 1 hour to 2 hours should probably cover it. I mean, if you go offsite and have coffee, if you have lunch, it may be a little bit longer
because of the travel.
Because of the travel, and because you may be eating and things like that. If you're meeting in their office or your office, or in the cafeteria even, you know, my suggestion is always come with an agenda of what you want to talk about. You may not get through everything, but prioritize it by what's most important. So if you really want to talk to people about, like, I'm just lost when it comes to the way we do certain things in clinic, put that as your number one item. Or if you really want to talk career, and you've kind of mapped out in your head where you want to go as an acupuncturist, or where you want the organization to go with their acupuncture program, put that at the top of the list. But have a specific agenda, and if you can, share that with your mentor, because they may want to do research beforehand and read up on certain things, or they may want to check and see if certain things already exist in your organization. So they may want to come prepared, or they may be kind of fly by the seat of their pants.
So maybe like if I have something really, as a mentee, someone who's being mentored, if I have something really specific in mind, like right now what comes to mind is like, hey, I'm pregnant. I know I'm going to have to take time off. I want to come back. I've never done this with this job before. What's normal? How do I learn about what the, you know, maternity leave and state laws are, like, you know, federal laws versus my state laws, and what can I expect, and how do I even start having that conversation with my supervisor? I could probably email my mentor ahead of time that I'm interested in this, and they could be like, oh, I haven't looked at those laws for a couple of years. It may have changed.
Exactly. And they may be straight up and say, you know what, that is so out of my lane, but we're going to put you in touch with the right people, because I'm not the expert. Unless they're a human resources person or a labor relations person, they may say, you know what, that's so far out of my lane, but I'm going to get you in touch with whomever. And they may have worked with that human resources person for 15 years. Mm-hmm. They may be able to call them right up and say, I'm going to have a meeting with my mentee. This is kind of what they're facing. And that person may be like, oh, well, let me give you, 15 resources that person has to have. And by the way, send them to come see me. And let's get them on the right path before it's time for them to tell their boss, hey, I'm going on maternity leave or paternity leave,
Right. Or any kind of family
or any type of family leave. Yes.
Yeah.
Caregiving leave, etc.
Yeah.
Yeah.
Or I've had to have surgery, like that kind of stuff. Okay. Excellent. Well, thank you very much, Sondra.
You're welcome.
We went through our whole list for today.
That flew by.
Yeah. and it's a little after 7. So what is there anything else you want to say as we wrap up?
I would just Megan and I were talking before we came online to do our session about Harvard Business Reviews. So they have some fantastic articles and they have some non-fantastic articles, but they have mostly fantastic articles, oftentimes with research to support what they are suggesting or covering. And so talking about mentoring and coaching, mm-hmm. I would definitely look at Harvard Business Review for some insight as well.
Okay. And we can provide those links afterward. So, all right. Well, thank you all tonight. Well, I really appreciate you tuning in, and it was really great to be able to interview you, Sondra. So thank you very much.
My pleasure.
Good night.